have to remember who we are.
Cardiovascular diseases are the #1 cause of death. More people die annually from cardiovascular diseases than from any other cause. An estimated 17.3 million people died from cardiovascular diseases in 2008, representing 30% of all global deaths. Of these deaths, an estimated 7.3 million were due to coronary heart disease, and 6.2 million were due to stroke. Welcome to another episode in the series of Health and Wellness. I'm your host, Roseanne Green. Today we'll be zooming in on the issue of stroke and cardiovascular disease, sharing the story of a survivor, Lurlene Brown, and sitting with Dr. Robert Gucciardo as he offers some professional insight of how to prevent, correct, and live a healthy life with cardiovascular disease and stroke. Stay with us. Thank you so much for staying with us on the program Health and Wellness. I'm your host, Roseanne Green. I'm sharing the story of a survivor. She has survived stroke and also a heart attack. Thank you so much for staying on the program, Lurlene Brown. She's going to speak to us about her journey before she had stroke and after recovering from that. Let us start first with before stroke. What happened? What was life like before?
Well, before a stroke and life, I am an athlete. Used to play softball.
Right.
Very good life. No problems.
Mm-hmm.
Came up with high blood pressure, which is a family trait. Most of us have high blood pressure. My mother and my father both suffered with high blood pressure, so it's hereditary.
Right.
Yes. But on August 24 of 2004, I suffered a stroke. Well, they said they didn't know what caused the stroke. It was an acute stroke.
Right.
When I got to the hospital, my pressure was 168 over 232.
Oh, wow.
Yes. But I got the stroke. My left side was completely gone. My voice was also gone.
Right. And you were a singer before, right?
Yes, I used to. I still do. Thanks be to God, my voice came back. So I still sing.
Right.
Not as much as I used to,
Right.
but I still do sing in the church somewhat.
Oh, wow.
Yes. And it was so bad, I didn't have any movement on my left side. My left hand was gone.
Right.
I had to drag my feet. Couldn't turn in the bed.
Mm-hmm.
Then I had therapy. And one of the things that I did, I got in contact with a Chinese woman that did deep massages.
Right.
When I met her, she said to me, "Don't worry, you'll be okay."
Oh, wow.
And I took deep massages every Saturday for 3 months for 45 minutes. When I got out of that place, I was all black and blue all over. But she found exactly where the stroke was.
Right.
So she was able to massage. With that, I gained back movement.
Right.
I was able to walk properly, use my hands, and all that.
Oh.
So,
leading up to you having the stroke, take us back a few days before. How were you feeling? Did you have any signs that the stroke was coming on?
No, I didn't have any signs the stroke was coming on. But it was a very hot summer. The days were like 108 degrees, 105 degrees for about a week in a row. But on that day that I got the stroke, it was 105 degrees. I had gone out to shop and I started to feel a heat coming out of my body. And I said to my husband, "You know, funny, we are in an air-conditioned place, but I'm feeling very hot."
Oh, wow.
It was so hot that he said to me, "Okay, go sit in the car under the air conditioner and maybe you feel better.
Right.
But I didn't. It got hotter.
Oh, wow.
Yes.
And that was the
Yeah.
day off or the day?
The day of that I was getting the stroke.
Right.
But I went uptown to have lunch with a friend, and it was so hot that I took a bottle of cold water and I drank it.
Mm.
When I drank it, I felt it went straight down to my stomach. And then I started to feel my mouth. You know, like I
Feeling
was,
funny,
yes,
right.
my tongue was tingling and, you know. So I said, I better get home because I really wasn't feeling good. I took the train and I got home from 34th Street to 17th Street in Brooklyn.
Wow.
While walking home, I began to feel like my feet were getting heavy.
Right.
And I got home, but I went and I laid down. Went to the airport the evening to pick up my granddaughter. She had gone to Costa Rica.
Right.
And while I went, I felt myself fumbling and walking sideways.
A little bit funny.
Yes.
Right.
So I went home. No pain, no aches, nothing. You know, laughing, having a good time with my granddaughter coming back from Costa Rica. And I went to bed. The morning I got up, I went to the bathroom. My granddaughter said to me, Grandma, you walking funny. You're walking sideways.
Right. You didn't realize you were
I didn't realize that. So then I said, if you see that I'm walking sideways and I'm not feeling it, I need to go to the hospital. Went to the hospital, met a doctor. He didn't tell me anything. He just said to me, your pressure is very high and I'm not letting you go until I get it normalized. I stayed there for about 7 hours, and then he said to me, we are going to admit you. He still didn't tell me that
what was going on.
No.
Wow.
I got upstairs to the unit, and the nurse said to me, can you walk? I said, yes, I can walk. I came in here walking, and I'm going to leave here walking. She said to me, well, you know you have a stroke. You're having a stroke.
And up until this time, you weren't feeling?
No, nothing at all. So she said to me, if you can walk, she gave me the clothes and she told me, go to the bathroom, change, and get back in get into the bed. I did that, and I got into the bed. That night, I got upstairs about 12 o'clock. About 3 o'clock in the morning, the machine started to, and everybody came, and then the doctor said to me that I suffered a stroke.
Even when the machines start moving, you still weren't feeling anything?
Nothing.
Oh,
absolutely nothing. No pain, no headaches, nothing. Absolutely nothing.
Right.
Then I went to, they gave me the IV, whatever they put in there, whatever. The morning I got up, I was trying to go to the bathroom. And I felt heavy on that side, but I said, I'm going to go to the bathroom, and I went. I pulled myself up, I held on to the wall, and I got to the bathroom. Got back in the bed. The nurse said to me, it seems as though you moved. I said, yes, I went to the bathroom. She said, don't you ever do that again because you are having a stroke. And if anything, we'll be liable.
Right.
But when I got up again about 10 in the morning, there was no movement.
Oh, wow. That's when you really realized.
The stroke had set in.
Oh,
yes.
Wow.
So I stayed and I took therapy. They sent me home. When I got home, I couldn't walk. They had to take me to the bathroom, you know. But then again, I met this Chinese woman, and she worked for me, and I was able to.
And coming out of the hospital, what was the mindset like? What were you thinking, knowing that one side of your body is not working?
But you know, with all of that, I never gave up. I never got scared and think that I would never walk again or anything like that. I just felt that maybe it was just a time of rest, you know. Because when I got up, when I started to take the therapy the therapy, it wasn't much. They really wasn't giving you much therapy.
In the hospital?
No, they don't give you much therapy. I am convinced that once you have a stroke, they leave you.
They gave up.
They just give up on you also. So you have to really fight to get back normalcy.
Right.
Because the kind of therapy that they give you, it really didn't therapy
at
didn't
all.
work.
Oh,
No.
wow.
But when I met this shiny lady, she gave me a lot of herbs. Of course, it went with you have to drink a lot of herbs, and she
Right.
made her own
Right.
composing of herbs and things that you really have to have want to live to take these
Take
things.
all those stuff.
Yes, yes.
Okay. And we'll make
But
a comparison between, as we pause in the middle of the story, make a comparison between what you were taking in the hospital and what you're taking when the Chinese doctor gave you all that stuff.
well,
What's the difference between
the
both?
difference is that everything was from the sea.
Mhm.
She took seashells, seaweed, all kind of different stones, rocks, whatever, and she would just, uh, mash them
Right.
and boil them, make up tea, and that's what I had to drink.
How was that?
It was terrible.
Oh, wow.
Smell terrible,
Right.
taste terrible.
Right.
There's nothing that you can describe it as. It
Oh, wow.
smells very, very, very bad.
Right.
But
But you push on though.
oh yes, oh yes.
With what were you? What was in your head? What was the objective? Because I'm sure taking alternative medicine, a lot of persons are taken aback with it because it's a slower process.
It's a slow process.
But what's the benefit though to you?
Well, the benefit is that you come back to normalcy.
Right.
I was always a believer of alternative medicine, even before I came here, because I saw my mother suffer a long time with cancer.
Right.
And there was really nothing back in those days that they could give you for cancer. Once you had cancer, that was it. You just died.
Oh,
So I saw her in a lot of pain and,
right.
So I always never believed
Right.
in medicine.
Right.
So when I came here, I have a friend that has a health food store, and I started to work with her, and I began to do my own thing.
Right.
Now, my father had cancer, and I was able to go back to Panama, work with him, and he went into remission for 5 years.
Oh, wow.
Yes, 5 years. He went into remission. So I always believed in alternative medicine. It's a slow process,
Right.
but you have to want
Right.
to be healed.
Right. And you're a double survivor.
Oh, yes.
After recovering from stroke and getting back your singing voice, your beautiful singing voice, what happened after that?
Well, what happened? I went back to normalcy. I stopped taking the
All those
pressure
medications.
medications and whatever, and did my thing. But then, on a year ago, yes, well, we're 2 years now,
Right.
it was my wedding anniversary. I went out to dinner, had
Right.
some lamb, but it was very, very salt. When I got home the night, I had a pain in my chest, but it was a very pungent pain in my chest, and I said to my husband again, I need to go to the hospital.
Right.
And he said to me, if you said you need to go to the hospital,
You
let us
need-
go.
You need
He
to
said,
go.
let us go.
Right.
So I got ready. I went to the hospital. When I went to the hospital, funny, they took all kind of tests, but they didn't see anything wrong with my chest. But they kept me overnight for observation.
Right.
The next day, the art specialists, about 4 of them, came and they told me they would have to give me this angiogram to find out what's wrong, because they're not seeing anything.
Right.
Nothing at all is showing. And I'm arguing with them, and I'm saying, no, you're not going to experiment on me. I came here, I just have a chest pain. You can't find out what pain. I'm not doing it.
Right.
But a couple months before that, I had met Dr. Gucciardo at a women's conference. And I told him that I had a stroke. When he tested me, he said, okay. And he gave me a preliminary test, and he said to me, I know exactly what's wrong with you. I'd like to see you in my office.
Right.
And I went, and when I went to him, he found out that my carotid glands, they were clogged. So I stayed with Dr. Gucciardo for that 1 year,
Right.
and I took medication, supplements, because it's supplements.
Right.
So when I spoke to the doctor the one, I said, I go to a naturalist and I need to speak to him. After I speak to him, if he says I must take this test, I'll take this test. If not,
Right.
I'm not going to
Right.
take this test. I'll go back home.
I totally understand.
So I spoke to Dr. Gucciardo, and he said to me, Lurlene, take the test. If there's anything, they can fix it.
Right.
And if there's nothing, you continue naturally,
Right.
but take the test. So they prepared me, and I went down to take the test. I told the doctors before I took the test, I'm not taking no pressure medication. If they're going to give me pressure medication, it'll be one and a
Right.
water pill. I'm not taking any bunch
Right.
because I went through all of that and nothing
Right.
happened. Anyway, when I took the test, the angiogram, I had a 99% blockage.
Wow.
They did not know or see anywhere that blood was going to anywhere in my body.
How were you still alive?
I did. Well, I have to say what the doctor
Wow.
said, I'm a miracle.
Oh yes.
Because
definitely.
they could not see where, they said people came to with 43 blockage, died.
Oh wow.
Never made it. They didn't see how I got to 99.9.
Right. And how were you feeling the day when you?
I never have any problems. That's the problem. I don't have headaches. You know, some days you get up, you feel sluggish, you don't want to move around, but pains in the body, no. Headaches, no. And most people will complain of terrible headaches when they have high blood pressure and the pressure is high. But I never had any of those things.
Oh wow.
Anyway, so they gave me a stent.
Right.
So.
And what does the stent do?
Well, what the stent does,
what is it for?
it enables the blood, because it was blocked, they have to unblock it.
Okay.
So the stent is really there so that it wouldn't get blocked
Okay.
again. The artery wouldn't get blocked again.
And how is it with the medications? Because I'm sure you have to take a couple of medication. Oh no.
No. I don't like medications. I don't. So I stick to my supplements, which Dr. Gucciardo, I visit every once a month. I go and I make sure that I'm doing good. And I take one water pill. One water pill, but 3 in one, which they don't realize that doctor and I had a problem with that. Because I told him I'd only take one water pill. And one pressure pill. So what he did, he gave me a pill by the name of Tribenzor. When I read up on Tribenzor,
3 tablets in one.
It's 2 tablets in one plus a water pill.
Oh Lord.
Yeah. But I take it because I was advised by the Dr. Gucciardo to take my medication.
Okay.
And
do you take it along with your supplement?
I do take it along with my supplement.
Yes.
I do take it along my supplement. But thank God I am doing well.
Oh yes. Oh yes.
My pressure is normalized.
Okay.
It goes up sometime, but never over 90.
Oh wow.
You know, they say a normal pressure is 120 over 80. My pressure goes like 80, 86, you know, 120, 123, but it's normalized. Thank God.
And what would be your, as a survivor, what would be your advice to other persons who have the same complication or who suffer the same complication as you?
You know, I am I would say a fanatic of alternative medicine. Before I even started to go to Dr. Gucciardo, I have books that I buy from Rodale books on health. And I used to make my own portions. I used to suffer from sciatica. I would read the books and I would do what it says and I would take care of myself. My advice to most people is that God created the body to heal itself. But because of money in the pharmaceutical companies, they would go the drug way. Healing, your body would heal itself. It takes time, but you have to have the mindset to want to take the time, the patience to get your body healed.
Oh, wow. Thank you so much for staying with us on the program. Thank you so much, Mrs. Brown, for being with us and sharing your story with our viewers. Stay with us as we join Dr. Robert Gucciardo. Thank you so much for staying with us on Health and Wellness, and thank you for joining us in this segment, our Living Well segment with Dr. Robert Gucciardo, as we speak about heart disease and stroke, something that is persons are dying so rapidly from. What is the cause of this? What can we do?
Yeah, it is, especially stroke. It's one of the most debilitating diseases that we know of. And it can hit at any time, sometimes with no warning signs. Heart disease and stroke, they kind of go hand in hand because they have a lot of the same causes. They have a lot of the same causes. But let's just take stroke for a moment and just talk about that. Stroke, the most common cause is called ischemic stroke, and that's when there's a blockage in the blood vessels in the brain itself or going to the brain itself. And there's a number of different reasons why that can happen, and it's called a blood clot. But one of the things that is overlooked the most is actually blockage from a vertebral misalignment.
Oh, wow.
A lot of studies have been done showing that when the bones in the neck misalign, the arteries that run through there can be pinched. And when you cut off that blood supply for a period of time, it can cause major ramifications. And then over time, vessels above that start to get weak, and the vessels at that point of the kink become weak. And that can cause a lot of serious situations later in life. But there's other causes as well, and it's mostly dietary. Most of these things are dietary. We talk about plaquing of arteries. We talk about plaques breaking off and getting lodged in other areas, cutting off the blood supply. And that's debilitating. People can lose function on a whole side of a body or die. Or die.
Wow. Like our guest that we had on, Lurlene Brown, she spoke about her experience with stroke.
Yes.
She said, I didn't feel any different. They call it the silent killer. Why? They call it the silent killer. She didn't feel the stroke coming on, though.
Yeah. Yeah. She had very subtle symptoms, I believe. But, you know, it'll just hit anyone at any time, at any age. It doesn't matter. I just learned of someone who was in their 20s, one of the patients. Yeah.
Oh, wow.
Who said their nephew died of a stroke. You know, blood clot, broke away, stroked out, done. You know, so there's no recovering from that.
Oh, wow.
So we need to think about the things we can do to prevent that, right? Some of the biggest things we can do to prevent a stroke is, number one, get that diet in check, get the cholesterol levels down. And when I say get cholesterol levels down, I don't mean by the standard approach that we use today in medicine. We also need to get the blood sugar levels regulated properly. We need to get some exercise. We need to start moving more. As a country, we're not moving as much. We're not keeping our blood supply moving and flowing. That's one of them also. And, you know, getting enough rest, reducing your stresses that are in your life. And, you know, one of the other ones is smoking, because it constricts the vessels and it inflames the vessels, which will lead to stroke as well.
And one of the things that I found interesting from Lurlene's story, she spoke about coming in your office, and before she had the second experience, if her heart wasn't strong based on her nutrition program that she was on and getting help in terms of chiropractically, there's a possibility she would have died today.
Pretty much, yeah. There's crucial factors we need, right? Our body needs a certain amount of nutrients to sustain itself, right? Those nutrients are the energy that our organs use to function, so we need to eat healthy. But we also need proper communication, right? The brain has to communicate to the organs, to the heart, to all these different things. So if we're missing any aspect of that, there's going to be a weakness somewhere. And then
Okay.
based on tendencies with some people, like
Right.
family tendencies or genetics or hereditary
Right.
situations we look at, they could be prone to weak vessels. Yeah.
Wow.
And then you end up in a stroke situation. But yeah, if she didn't strengthen herself, she probably wouldn't have handled that as well. Yeah.
And let's before we go, let's touch on the heart disease. That's
Yeah.
a serious business.
It is. It is. The heart is a major organ. It's a major muscle. That's what
Right.
it is.
Right.
And it needs to be worked properly. But the heart can endure a lot of stress because it's, if you think about it, it's pumping the blood through the body. Boom, 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 all day. So it's working hard.
Right.
We need to treat it right.
Right.
So we do need to get some light exercise to keep it trained like any other muscle in our body,
Okay.
but we also do need to feed it properly.
Right.
You know, there's an interesting fact that the heart itself has a protective layer around it, and that protective layer is saturated fat. Yeah, saturated fat is real important for the body, and it actually is it gives the cells, the heart muscle cells and all our tissue cells, the integrity and strength that it needs to
Right.
sustain itself.
Right.
One of the things that we're lacking in today's modern diet is saturated fats because it's been demonized.
Right.
People say, you can't eat saturated
That's
fat,
true.
that's no good.
Right. Right.
You got these ads out there with butter in a tray, and if you look at it, there's razor blades in there, like they're trying to say that it's dangerous. Don't eat it, it'll hurt you.
Oh yeah.
But it's perfectly fine. We need it. Our cell structures need that. So I
Interesting.
think a lot of the reasons why we're seeing so much heart disease today
Right.
is the low fat, high carbohydrate, high sugar diets that people are employing today. It's not working. The past 25, 30 years, heart disease is not getting less, it's getting more per capita.
Right.
More people are experiencing it, but yet our diets are getting further and further away from normal. People aren't eating meat anymore because they think it's bad. People
Right.
aren't eating butter. They're moving to these chemically processed margins. You know, they're one step away from plastic.
Right.
So, and we're ingesting these things and eating them. So
Right.
it's just, it's not a healthy situation.
Right.
So yeah, heart disease, the heart is not getting what it needs to sustain itself.
Okay.
You know, we need a lot of B vitamins, and B vitamins come from some plants and vegetables, but the majority of the B vitamins we need to be healthy
Right.
come from animal.
Wow.
Yeah.
And in closing, one of the key things that you always say is the closer we eat to natural,
Absolutely.
the better.
Absolutely.
And I love that phrase, and I can't reinforce it more and more. And in my life, I find it helps tremendously that the closer you eat to natural, the better it is for
That's right.
you. Better it is for you. Wow.
Absolutely it is. And that's something that we've gone away from.
Yeah.
Yeah. Because your body can work more efficiently. It's getting the nutrients it needs. And listen, we've been given these bodies. This is something that we need to sustain for 100 years, potentially, right? And if we don't feed it right and we don't do the right things for it, it's not going to last. It's not going to last.
Exactly. And on that note, we have to close our segment on living well. But please remember, if you need to ask any question about what we spoke about today or any other health questions, please feel free to email Dr. Rob at drrob@drgucciardo.com. It's on the screen. You can see it. Please feel free to do that. Thank you so much for staying with us in this segment. Thank you, Doc, for always being in our Living Well segment.
Yeah, my pleasure.
Thank you much. Thank you so much for staying with us on this episode of Health and Wellness. I'm your host, Rosen Green. On behalf of the entire production team, I want to wish you good health and wellness.